Good afternoon and welcome back to GP Video Podcast by Nadia. So today we are doing fibromyalgia part 2, and I'm not sure how many of you have seen part 1, so I would like to repeat a few points because this topic, the problem with this topic is it is a chronic pain condition, as I said yesterday as well. The problem is this is a very widespread condition. We see a lot of patients in general practice with this problem, but the issue is that the cause is not known, the treatment is not very clear, and people suffer a lot from it. So I do not know what the future holds for patients of fibromyalgia, but at least the awareness about it and the look into it and knowing about it is very, very important. So what is fibromyalgia? Fibromyalgia is a condition characterized by chronic widespread pain together with multiple muscular tender points or associated fatigue, sleep disturbance or cognitive dysfunction in the absence of a well-defined cause. So chronic pain along with the muscular tender points in the body, all over the body, fatigue, sleep disturbance and cognitive dysfunction like in the memory or word finding or all that kind of stuff. As I said, the exact etiology or the exact cause of fibromyalgia is unknown, but it is a diagnosis of exclusion. So if a patient comes to us with chronic fatigue, widespread pain, sleep disturbance, cognitive dysfunction, we try with the blood test, with the scans, and even sometimes with the specialist referrals, we try and exclude everything, every possible cause of chronic widespread pain. And when we do not find everything is normal, we cannot find another reason, then we call it fibromyalgia. So symptoms of fibromyalgia are vague and generalized and usually wax and wane over time, but unfortunately never disappear. So they can get better, they can get worse, and there could be intermittent free intervals, but on and off happening, but they never go away forever. And unfortunately the prognosis of such patients is poor, and the poor in the sense that they unfortunately have to deal with this condition, and that is very, very sad basically. So pain is the primary complaint. The pain may be intermittent initially, like on and off, and then progress and become more persistent. So initially it's on and off. Sometimes you have very good days with no pain, and sometimes you have a lot of pain, but then unfortunately the pain becomes persistent, and there are not any days when you are without any pain. Then factors such as weather, like cold weather or stress, affect the pain. Other symptoms apart from pain include fatigue, sleep disturbance, morning stiffness, which is again a kind of symptom of inflammatory arthritis, but when you check them for inflammatory arthritis, all the blood markers and all the scans are normal. A feeling of swollen joints, again, feeling of swollen joints, but once you scan them or once you examine them, they are not swollen, like they do not have any problems, with no objective swelling. You can't see that, the doctor can't see that, the scans can't see that, but the patient would say that, would think that his or her joints are swollen. And problems with cognition such as memory disturbance or difficulty with word finding. There is a criteria for diagnosing it, as I said, after excluding everything, all the normal blood tests, all the normal scans, even seen specialists, everything is fine. Then 3 criteria, a patient fulfills the diagnostic criteria for fibromyalgia if following 3 conditions are met. Number 1, widespread pain index, WPI more than 7, or symptom severity scale more than 5. Number 2, symptomatology has been present at the similar scale for at least last 3 months. And number 3, the patient does not demonstrate any signs or symptoms of another disorder that would otherwise explain the pain. So number 1 is widespread pain index or symptom severity scale. Then number 2 is symptoms have been there for at least last 3 months. So we're at the same severity scale. And there is no other cause. So this is the vague criteria for diagnosing a patient with fibromyalgia. Most physicians rely on a combination of symptoms and normal blood testing to diagnose fibromyalgia. Only limited laboratory testing should be conducted for most patients. I mean, they say that only limited laboratory, but if we want to try and exclude all the causes, of course we have to do everything to try and exclude arthritis, try and exclude autoimmune conditions, try and exclude other inflammatory conditions, do the scans, and then we will say that okay, everything is normal. Now these three criteria are met, and then we will diagnose as fibromyalgia. There is no cure for fibromyalgia, as I said before. Treatment should focus on improving symptoms and maintaining optimal function. The ideal management plan should include a combination of non-pharmacological and pharmacological treatments in a multimodal approach tailored to the individual patient. Exercise programs have been helpful in improving general well-being, physical function and pain, and they are currently recommended as the first step of a multimodal treatment strategy. So exercise programs. Antidepressants are associated with improvements in pain, depression, fatigue, sleep disturbances, and health-related quality of life in patients with fibromyalgia. So the first medication that they mention here is antidepressants. There are some antidepressants like there is duloxetine, there is amitriptyline. These two are very good in treating neuropathic pain. So usually they are preferred in patients with fibromyalgia, though there is no evidence of neuropathic pain, but because these are antidepressants as well as good for neuropathic pain, so they are usually the first line of defense or the first line of medications, but other antidepressants can be tried as well. They say that medications should be kept to a minimum whenever possible. Strong analgesics, including opioids, should be avoided. The prognosis remained poor for the majority of patients with fibromyalgia. Unfortunately, because pain sometimes becomes so devastating and so debilitating that usually these patients do go on opioids, and yes, we can take them off it gradually and slowly, but the quality of life is very poor if we are not on strong pain, if we don't put them on strong painkillers. So yes, Panadol can do, non-steroidal anti-inflammatory drugs like Nurofen, Celecoxib, all these Advil. But again, the problem with non-steroidal anti-inflammatory drugs is you cannot be on them forever. They are short-term medications, and then come the opioids. But first line of drug that they have said, okay, we can try with the antidepressants and see how it goes. But again, this condition is very, very hard to manage, and yes, people do end up being on opioids, but if the quality of life is not good, again, it's very, 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 I find it very challenging in general practice. So hopefully there would be, with all the medical inventions and everything, we'll find an answer and we'll find a cure for this dreadful condition. See you next time.